Greetings from Institute of Neurosciences, Manipal Hospital Sarjapur Road. I am Dr. Shiva Kumar here, Senior Consultant Neurologist and Epileptologist. I am here to talk about a little bit about migraine. You know, headaches are very common in the community, and of this, migraine is the most common reason for someone to have headaches. Migraine has got its classical symptoms like unilateral headache associated with sensitivity to light and sound, nausea and vomiting, which usually lasts for more than few hours and can last up to 72 hours. So, knowing migraine is not important, but knowing migraine when you don't have the classical symptoms is very important for you. They can present to you with history of buzzing in the sounds called as tinnitus, giddiness, vertigo, associated with nausea and vomiting without headache. They can have numbness and tingling and burning in hands and the feet without major headaches. They can have problems like recurrent abdominal pain, which can look like gastritis or irritable bowel syndrome. They can have sleep problems, which can sometimes be associated with migraine. So, migraines can be atypical sometimes. So, identifying migraine in its true sense is very important for us to know the treatment options for this. To know that there are two aspects here. One is to prevent the next headache happening. The other one is to treat the current episodes which are causing trouble to us. So headaches can be prevented only when you know about your own triggers. This is called as self-learning. So for this you need to maintain something called as headache diary. It should contain the trigger for headaches, which can be related to change in environmental conditions, food habits, certain food additives, lack of sleep, stress, anxiety and depression. And there are other reasons like hormonal changes in females, and taking certain medications like oral contraceptive pills in females can also be reasons for triggers. The most important thing here is that the triggers can change from person to person, and one should be aware of their own triggers rather than generalizing the triggers for everyone. So once you know the triggers, then avoiding these triggers is the first step in the treatment of migraine. Once you have done this, and if the headaches are not getting better, then we have certain medications which are to be given for a few weeks, sometimes up to few months, for us to control the migraines. So with this treatment, we have a lot of options, including tablets, injectables, and we have certain devices also which are approved for treatment of migraine. I always say to my clients that 4S is the very important thing for preventing migraine. One is you need to reduce your stress, you need to keep your screen time to a very low level, you have to keep your sleep good, and the most important thing is self-learning in migraine. You need to know what are the reasons for the migraine to get triggered, and you have to treat this according to the triggers what you know. So with this, I would like to say that migraine is easily identifiable and treatable. At times it might be difficult. Once you identify, a good proper lifestyle modification, good medications and good advice from a specialist is going to help you. For more information on other neurological disorders, you can follow us on Health Facts by the Manipal Hospital channel. Thank you very much.